Good morning and welcome to the launch of this community of practice for social care analytics. I'm Josefine Magnusson. I'm the Senior Research Officer at Future Care Capital, and I have been the lead on setting up and organising this community of practice. Future Care Capital, for those of you who don't know us, is a charity and health and social care think tank. We have a particular interest in data, technology and innovation in relation to health and social care. And because of this, we are particularly pleased to be leading on this community of practice with support by the Health Foundation. This morning, we are going to hear from a number of speakers. We are first starting off with Sophie John from the Office for National Statistics, who is going to set the scene by describing the work that the ONS are doing in the space of social care data. And then moving on to Adam Steventon from the Health Foundation, who will be talking about their programme of work around strengthening social care analytics and how that led to the setup of this community of practice. After those two, we will be taking some questions from the audience, and if you look to the right of your screen, you should see the box for posting questions and comments. And we encourage you to use that throughout the event to post any questions or comments you might have, to reply to other people, and to generally have a conversation through there. If you want to post questions to particular speakers, then please direct the question to them by writing their name within your question, and we will put that to them. The only other thing I need to say is that we will be recording this event so that people who can't join us today will be able to look at it at a later date. And I think that's all I need to tell you for now. So with no further ado, I'm going to hand over to Sophie John, who is the Head of Social Care Analysis at the Office for National Statistics. Over to you, Sophie.
Thank you, Josephine. So yes, morning everybody. So as Josephine said, I lead the social care analysis team within health analysis and life events here at the Office for National Statistics. And today I will just briefly go through some of the work that we have been doing at ONS in relation to social care data. So moving on to the start of the presentation, please. Thank you. So we are a relatively new team and were put together as a result of the OSR recommendations paper outlining the gaps in evidence surrounding social care data. The research highlighted a need for improved leadership, collaboration and accessibility of official social care statistics. It also highlighted issues with comparability of adult social care data from across the 4 nations, and also the gaps that there are in evidence. So as illustrated there by the Grand Canyon, there unfortunately are some quite large data gaps in certain areas. So for instance, not enough is known regarding the volume and value of privately funded provision of adult social care, or the burden that is placed on unpaid carers. So this essentially has informed the creation of a work programme for us here at ONS. Next slide, please. So we've made our first step forward towards making improvements to accessibility by releasing a new interactive tool where users can easily explore a landscape of adult social care data in one place. Essentially, this is a search tool where users can find links to official social care statistics from across the UK in one place by simply searching by theme, keyword or country. And we update this with new publications on a monthly basis. And we are working to further improve the accessibility of this tool. Next slide, please. So as I'm sure you are all aware, adult social care is devolved and therefore data from across the UK is not always directly comparable. We are working on a piece currently with stakeholders from across the 4 nations and together with the GSS harmonisation team to outline the impact that this has on data. The idea is that this piece will sit on our landscape page to make it clear to users what data can and cannot be compared across England, Wales, Scotland and Northern Ireland. Next slide, please. So in the ONS, we produce a number of different mortality outputs, but none covered deaths to UK residents. So using the death registration data that we have from the General Registry Office, we have produced a new output covering deaths in the care sector, and from now on this will be produced annually. 2019 is the last year that we have a full set of data for. So next year we will be publishing 2020 data, and this will come out in the summer, so after we've done our general death registration in the population release. So this helps us to understand a bit more around the causes of death in care home residents, including characteristics, geographic breakdowns, just to inform policy. And as stated on the slide, so one of the things that we can calculate as part of this is age standardised mortality rates. However, these are based on estimates, since generally, apart from the 2011 census, it's quite difficult to get up-to-date information on the care resident population. So to calculate these rates, we used 2018 based population projections that we have here at ONS for communal establishments, and then have applied a care home resident proportion using the 2011 census data to ascertain an estimated care home population for England and Wales. But the number of residents in care is another big gap in the data. I mentioned the census, so we've also been able to do some linkage to our 2011 census data set to look at some protected characteristics of care residents, and we will continue to do this when we have the updated 2021 census data through. This piece covered our death registration data, as I mentioned, but we also included death notification data that is available from CQC and CIW. And CQC data also covers deaths to those in domiciliary care, which is data that we do not have. So by working together with CQC, we were able to provide these estimates within the publication. Next slide, please. So 2020 has been an unprecedented year, and to support the COVID-19 analysis, we released two releases back in the summer and earlier this year in relation to deaths involving COVID-19 in the care sector, covering those deaths in England and Wales. So this covered those deaths involving COVID-19 to care home residents. Again, on this piece, we worked in collaboration with CQC and CIW, since their death notification data is timelier than our death registration data. And obviously, you know, we're still in the midst of this pandemic, so we continue to closely monitor deaths involving COVID-19 in the care sector, and we plan to publish further articles in relation to the pandemic in the new year. Next slide, please. Thank you. So I mentioned the 2021 census earlier, but there is a question in the census relating to unpaid care, which we are the topic lead for. So you can see an example on the right-hand side, which is an example of the question that will be asked on unpaid care in the 2021 census. Our involvement is assisting the census teams with wording and design of the question, but also the supporting material around unpaid care. But also we help with QA and testing of pilot data, which we hope to begin in the new year. We're currently as well putting together analysis plans of how we will use the census data once we receive it. And the census white paper outlined the importance of data linkage. So we are thinking about how we can link the census data to other health data and health-related data sets that we have available here in the office. Next slide, please. So this takes us on quite nicely to the academic partnership that we currently have with the Centre for International Research on Care, Labour and Inequalities, otherwise known as the Circle Group. And I know you will be hearing shortly from Dr. Matthew Bennett as part of the panel discussion, who's also part of the Circle Group. But at ONS, we are acting in a supervisory capacity to 2 PhD students and providing them with access to our data assets. We will enable them to ask novel research questions and fill gaps in knowledge surrounding unpaid care. And as part of this, we're looking at how we can link the 2021 census results on unpaid care to the data that we have available to help the students to answer their research questions. Next slide, please. The last piece of work then that I wanted to cover is a larger programme of work that we are setting out with help from Future Care Capital. So we're working with Josephine and Anne-Marie in relation to self-funders. Our aims are to estimate the size of the self-funding population and within this be able to identify characteristics of the self-funder, such as looking at things like age, sex, marital status, and any geographic differences in self-funders, so whether we see any difference in urban versus rural areas. This is a relatively new project, and Evie Brown, who I know is on the call, is our data science campus apprentice, and she has been working on clarifying research questions, looking at the methods that are currently in place and the data that we could use to help answer our research aims. Evie has been developing a care pathways model, which you can see on the right-hand side, which has been put together to help visualise the different routes of access to care that we've identified through the research we've done so far. And over the last few weeks, kind of researching the definition of a self-funder in adult social care, it's clear that this is quite a complicated and wide-scoping area of work, and therefore initially we are going to focus on a few prioritised research questions. But as I say, this is going to form a larger programme of work, so we'll take a period of time. And we actually hope to use this community of practice going forward to stimulate discussion around this programme of work and get your expert feedback and advice on the project. So, for instance, in relation to the care pathways model that we have created and presented here. Next slide, please. OK, so finally then, just to provide a brief overview. So at ONS, we hope to work to improve the social care data available, working in partnership with others and ensuring that data availability is improved and getting notice to help support policy within this area. Thank you.
Thank you, Sophie. That's really nice to hear about the work that you're doing, and of course we are really enjoying working with you as well on the work that we're doing with the self-funders. So we can talk a bit more about that, maybe if people want to ask questions about that later. But right now I'm going to hand over to Adam Steventon, who is the Director for Data Analytics at the Health Foundation, and the Health Foundation obviously are supporting this community of practice. We're very pleased to be working in partnership with them. Over to you, Adam.
Hi, thanks, Josephine, and it's really exciting to be here and to have so many people joining us on the call as well. You're all very welcome. I've been working with Josephine and the team at Future Care Capital over the summer to see what we can do to improve social care data. It strikes me that this couldn't be more important, and I don't need to tell you what social care users and their carers have been through this year. It's been chilling looking at some of the statistics coming out on the Tuesday morning from ONS. I suppose the deaths are the most obvious statistic and one of the most striking, but there is still a hidden pandemic happening in care homes and domiciliary care. There are effects which are not visible through the data, but no less real, related to the well-being of care home staff, domiciliary care staff, workers, residents, the families. I'm a data person, and I run a data team at the Health Foundation, like many people in this room, when some of these statistics started to appear back in the spring, my first reaction was to think data can help here. It can help in all kinds of different ways to tackle the virus and to support better care for some of the people in our community who most need it. Data's never the whole solution, but it can help. Back in the spring, we wanted to use data to identify outbreaks in care homes, get PPE to the priority places, understand the health and well-being needs of service users and the staff. There's people with social care needs who can't access services as well. Right now, there's a need to use data to target the vaccine, to understand missed care and unmet health needs within social care. It could help to reunite families. And the truth is that data has done a lot this year in social care, and there's been remarkable innovation. The work that ONS has done has been fantastic. For example, the Mortality study has been fantastic. But it has been an uphill struggle this year, hasn't it? In large part because social care data and the analytics system just hasn't had the same kind of investment as data in other sectors. And here I'm talking about the data, which is very fragmented. It's held in lots of different organizations. It's rarely brought together. But more than the data, talking about the people who turn the data into actionable insight, the analysts working within the sector, and the service users as well. And the support for those people to come together and share ideas, as well as the people who need the data and about how they're supported to ask the right questions and be good consumers of data as well. There's a whole set of connected issues here to do with the social care analytics system that have been, I think, really thrown in sharp relief this year. So it was that at the beginning of the pandemic, it was hard to figure out how many people were even receiving or needing social care. The folks that who were trying to advise SAGE and to thinking about how the virus could be contained found it hard to access the data they needed about care home workers, and really struggled to understand how agency staff move between care homes. Testing data, as was not widely available in the way that a lot of people wanted it, needed it. So it's been an uphill struggle. We've been exploring these issues with Future Care Capital, as I said, over the summer. We've had a series of workshops with people who need or use social care, care home workers, commissioners, regulators, government organisations. And actually, this has really revealed some deep-rooted issues to do with social care data, which go far beyond the pandemic existed long before. Social care users have told us that they're reluctant to share data with local authorities for fear that the data might be used to restrict their entitlement to services. And more than that, social care users have told us they felt unheard because they feel that data about their experience is not collected. The data sets are very much organised around care packages and the finances. As a result, some of the people with most energy and drive to improve services feel disempowered when it comes to using social care data. Care providers have told us that although they wanted to share data to support the improvement of services and efforts to tackle the pandemic, they've had real barriers to overcome, which have sometimes held them back from being able to share data, many of which are to do with the bottom line and the financial realities in which providers operate. So there's been real progress, but it's been an uphill challenge this year. And what we'd like to see is that this is the beginning, not the end of the story for social care analytics. We'd like to build on the success this year, raise our sights in terms of what analytics can do and what data can do for social care, and to continue to support brilliant work in this area. With Future Care Capital, we've been calling for a new strategy for social care data, new national strategy, which is first and foremost about using data to improve care for people who need it. And this could be as transformative as the one for healthcare data. It could help, we could be using data to bring to light the experience of individuals in terms of the care they need and the care they receive. It can support better research. It can help develop better technologies. Social care data can be good for the economy as well as for the individuals. But what we need here is to pull together a critical mass of people, people who are passionate about improving social care for those who most need it, passionate about the ability to use data better, and that's what this community of practice is about. Future Care Capital are leading the initiative. We'll hear more from them in a moment, but Health Data is very proud to support it. What we hope is that in these meetings, we will just start to have a different kind of conversation around how data can contribute to meeting the challenges that the sector is facing, and how the data analytics system in social care can be developed as well. There's a need here to set the norms in terms of how data is used within social care, to develop new approaches, to share ideas. We hope that the community practice will be practitioner focused and grounded in the realities of using data to improve services, but also not afraid to raise its sights and have conversations about what kind of social care system the UK needs post-pandemic. That's ultimately what it's about. Really looking forward to being part of the conversations and hearing what you come up with and what you manage to achieve over the next year and beyond. Thanks, Josephine.
Thank you, Adam. Really great to hear about the work. I know some of it, of course, because we've been talking about this for a long time now, but it's really nice to hear it laid out like that as well. I'm going to take a couple of questions now. So first, I have a question for Sophie, if the landscape tool is available at all and where that can be accessed.
Yes, so the landscape tool is publicly available. It's on the GSS website, but I can send around a link or put a link on a platform somewhere, is there, Josephine, where I can post it so that everybody can access it.
Yeah, we can put a link in the forum to the landscape tool as well.
Right, thank you.
And I also have a question which I might put to Adam, actually, which is what practical issues do you see for smaller care organisations on the ground to develop analytics capacity?
I think, so I'm hoping to learn a lot from the people on the call, so I can actually put it back to the community to answer this, and people on the call who are closer to me. But I think the one thing that's really struck me is that there is remarkable innovation within social care providers. We've just launched in fact, some months ago, we launched a funding call that aims to support providers and local authorities to use data in new ways. So that calls for 33 applications, many of which are really exciting projects. We can't share them with you yet because we haven't made the final decisions. But there's a lot going on. I think there's a lot we can learn, a lot of places where we can learn from each other. And that's one of the aims of this community of practice, I think. For sure, there are a lot of barriers, and I suspect that some of the themes that are going to come up are about investing in the need to invest in digital data systems, the need to support staff, the need to make sure that the consumers of data know what data can add, can ask the right questions, can interpret the analysis. I expect that's some of the things we can get into. But as I said, there's a lot we can learn from each other, I think.
Thanks, Adam. And yeah, I do encourage anyone to who is in the audience to keep replying and adding your own sort of thoughts and initiatives on these questions as well. We take the view of the community as a whole. I have another question that I think is for Sophie as well, which is about ethnicity data. And this is something actually that we at Future Care Capital have also highlighted, the kind of the lack of data on ethnic minorities in particular in relation to COVID. I just wonder if you have any thoughts on that and what is available.
Yeah, so ethnicity is a difficult one. with our data, ethnicity is not recorded on the death certificate. So any information like that we need to obtain by linking our mortality data either to the 2011 census or to the patient register. It's difficult because we don't currently have any data sources that provide a breakdown of the care population for England and Wales by protected characteristics, so things like disability, religion or ethnicity. So therefore it's quite difficult to provide a population as a context for the number of deaths within particular ethnic groups that have been caused or involve coronavirus. When we bring COVID into the mix, it can produce some quite small figures for certain ethnic breakdowns. So the majority of the people that are in care homes are white British. We do have a piece of work that a team did within ONS on coronavirus deaths and ethnic breakdowns. Again, I can provide links to that. It wasn't done by our team, but a separate team who works in mortality. And there are some estimates on there in relation to deaths in care homes. So not deaths to all care home residents, but just those care residents that are dying in care homes, split out by some ethnic groups. But again, I can provide that information following the event today.
Thank you, Sophie. I think we're going to move on now to talk about, I'm going to give an overview of the community as it is and what has been developed to date. And I think that would also answer some of the questions that have come up in the Q&A. So I am going to ask that my presentation is shared. Thank you very much. So this is going to be an overview of the work that we have done and what has led us to develop this community of practice within Future Care Capital. And I'm also going to show to you how the discussion forum works and how to join that so that you know where the kind of conversations are taking place following this event, as this is only the kickstart and only the beginning. So can I have the next slide, please, Taryn? So at Future Care Capital, we have been looking at social care data for quite a while now, quite some time. Like I said earlier, social care data or data and technology is particular focus areas for us. So we have looked at provision of care and stability of care home markets in reports on facilitating care insight and data that cares. We have looked at the experiences of unpaid carers, and also, as Sophie suggested earlier, we started looking at self-funders, how best to identify those. And we've also produced a sort of social care data finder, which is slightly less advanced than the one that the Office for National Statistics is doing, but nonetheless is a resource for accessing and finding data sets in relation to social care statistics. Throughout all the work that we've been doing, one of the sort of common threads is the gaps in data. And that's why we've been working with people like the ONS and the Health Foundation in order to best address that. And that's where this work is coming from. So can I have the next slide, please? So the work that we were doing with the Health Foundation earlier in the year through workshops and other webinars, we identified that there was a particular need identified by the people who are participating to address certain topics in 3 specific areas. And these 3 areas were, first of all, to improve the quality of care for cohorts of people that experience the worst outcomes, to build a safe and resilient workforce, and also to understand the lived experience of people needing social care. So because these are the issues that have been identified by people working on the ground and working in this particular space, these are the topics that we set out as a starting point for our community of practice. So once you join the discussion forum, you will see those 3 topics being a particular profile at the moment. That doesn't mean that that is the only thing that we are going to be looking at throughout this community, and I want to stress that this is a community run by the community, so it's owned by the people who are part of it and who are joining the community. So where there are other topics that are of interest, we encourage people to bring those up and bring those up for discussion and link in with other people who are interested in that. But this is where we're coming from. So you should all have received a link to join the discussion forum part of the community of practice, and that's where all the conversation is going to be happening. So can I have the next slide, please? So when you have joined and first log in, this is what you will see. This is sort of the front page. And what we have here are a list of the topics that I just described. And you can go into each of the topics to reply to them, to start up conversations, to put in links to anything that you think might be relevant, whether that is work that you're doing yourself or that you have noticed other people doing. We are very keen to gather a sort of database of examples of best practice so that we can have this to draw on and use as a reference point for the future. So we encourage you all to sign up to the discussion forum as well and to continue the conversations in there. And to address some of the questions that have come in through the Q&A, I would say that this is social care in its broadest sense, in the terms that we're not just talking about care homes, we're talking about all types of social care. So we're looking at so issues around domiciliary care, for example, are just as relevant as care homes or residential care. We're not just looking at older people, we're looking at all working age adults and any kind of issues that might come into that. Can I have the next slide, please? So, as Adam has already said, we encourage you to join the community so that you can be part of a network working with other people in your field. It will be a space for sharing experiences, for asking questions, for asking for help if there is anything in particular around social care analytics that you think that other people might be able to help with, but you're not quite sure about. We're hoping that you can draw on the community for those kind of issues. We are going to be running a program in the early stages of the community that will include live events and other type of activities like that. But we're just as keen to hear from you, from other people who are involved with this, if you have ideas for events or for other types of activities that you think could be usefully done through the community. Again, this is your community, so we encourage you all to do that through there and to draw people into whatever activities you're undertaking in your own workings that are relevant for social care analytics. So I think that the only thing that is left to say is to please sign up for the community, join in the conversation and keep an eye out for forthcoming events and other things like that we're going to be posting in there that you can join into the future. And I am now going to take a few more questions. We were actually supposed to be going to a panel discussion at this point. Very sadly, we cannot get the 3 panelists to join us. These are technical issues with Microsoft Teams, and none of them, unfortunately, have been able to join us at this point. So I am going to take some more questions from the audience instead, and if they are able to join us, then we will reconnect them. But at this point, I will take some more questions. So we have one question here. The self-funding is very interesting and important. As when I was in practice, this was often overlooked and less time was spent with a person who was classed as a self-funder than not. This was a number of years ago, but I still see this as an issue. I don't know, Sophie, if you want to say something on that.
Yeah, that's really interesting. Thank you. I think it's, you know, these sorts of like anecdotal and qualitative aspects that are really important in, you know, for us to be able to discuss here, but also can feed into the care pathways model that I presented briefly on the slide. You know, all of these things are really important things to consider, and this is why we want to try and use this community to make sure that when we're doing this work on self-funders, you know, we've considered all of the different pathways that people can take in terms of being and how they come to be a self-funder. But, you know, bringing in all of these different aspects. I know that you mentioned that it was a few years ago, so it would be interesting to know, you know, if this is still an issue now, and how we could maybe tap into that would be something to consider. I don't know, Josephine, if you have anything to add to that.
No, I think as the work developed, I think we will look into this more. And I would say also that, as you mentioned, we are publishing the model for identifying self-funders in the new year. So we will be looking at feedback on that from people. So just to keep an eye out for that coming, and so we can really get that the perspective from a wide range of stakeholders in that area. Next question, what would be the biggest challenges of moving towards a truly personalised care plan as envisaged in the integrated care systems? How can the community of practice help with that? And I might actually pass that question to our Director of Policy and Strategy, Anne-Marie Naylor.
Hi everybody, and apologies for joining off screen or off camera at least. We're delighted that you joined us today. I think there's some really interesting questions that relate to this, Josephine, from the community already in the Q&A, which are asking the important question of why we're looking at social care kind of data in seeming isolation. How does it read across to integrated health and care data sets for the purposes of planning in the new integrated care systems that we're expecting to come online without much delay, really, given the new legislation planned for next year. And then what data sets might be out with those health and social care data sets. So I think I'll pull Adam in as well, but I think earlier in the year it was really clear to us that a lot of people wanted to make the distinction, particularly people with lived experiences of services themselves, between health and social care data sets, because they wanted to feel that there were things that were about them and about the services they received and required that weren't also about their health in every instance. So I think there's a real need for us here to differentiate between the different types of data that are available across the social care system, the types of insights they can drive and how they can support different aspects of planning for services, but also for people's personal planning for their independent life expectations and ambitions. So not always a sort of system-driven approach to the data sets. Adam, is that where you would see the same thing?
Yeah, I think one of the things that's really struck us is that there are some quite significant differences between social care data and health care data. Not least is the fact that, I mean, I don't need to say anybody on the call this really, but the social care sector is just a fundamentally different sector. You've got a very large number of really quite heterogeneous providers and nothing else, which are at very different stages of digital maturity. We've got a big variety of different types of needs to serve from this sector, and we just to emphasise that this community practices aiming to look at all ages, not just adult social care. So it seemed really important to have a space to talk about the specific challenges affecting social care data, which do differ from those addressing affecting healthcare data. That's not to say that there isn't tremendously exciting potential for more integrated care, and there are some specific opportunities arising through the integrated care systems related to having integrated health and care records, of course, and I think that needs to be brought into the conversation. But we really wanted to frame this community around social care data specifically because of the specific challenges that we have to overcome.
Thank you. As a follow-on question to that, do you think that we need standards for social care to move towards interoperability needed for personalised care? I mean, I know one of the objectives of the community of practice is to set up a set of common norms for social care analytics, and that is one of the first tasks, if you like, that we will be working towards throughout this program. But what about standards for social care data? How can that be? How can we go about doing that? Sophie, do you have a thought on that?
Sorry, Josephine, I'm having a few issues. Could you repeat the question?
Sorry, the question is, do we need standards for social care data to move towards interoperability for personalised care? And if so, how do we go about that?
Yeah, that's a really good question, and I think, you know, maybe that's something that we can explore. I noticed in the group, somebody's brought up maybe we should look at, I think it's Wendy Lippman, looking at aims and objectives for collaborating and things that we can, you know, look into addressing over the current year. And I think, you know, that would be an important thing to kind of pick up on through that, maybe like a wider discussion.
Thank you. Anne-Marie, you had something you wanted to add to that?
So, yeah, absolutely. I think it's a really important question, and one that's been kicked around by the Digital Social Care Expert Group and lots of colleagues within NHSX over recent months. I think the starting point here is that for those who are more into the detail of the coding out there, there's clearly the SNOMED standards that have been used in health, which are now in large part being applied to aspects of care. And I know that I think I see Claire Sutton in the community out there in the Q&A actually from the National Care Forum, who's a resident expert on these standards and where we're at with them through the Digital Social Care Alliance. So I think it's absolutely essential that we have standards that work for integrated care systems where it comes to commissioners, policy making and getting national insights out of these data sets. But I think we also have to be mindful that we're talking about thousands of disparate providers. So how do we incentivise and encourage people, not all of whom are already using extensive digital systems, to work with these standards to get us to the right point? So it's perhaps an ideal point to move towards, but the question is, how long will it take and how is that feasible in a practical sense for those providers? And I will defer to Claire, who can join in on Twitter and explain more in the Q&A if she wants to say more about the detail of her standards, because I know it's quite a sort of niche subject. But I think some of the issues that we found over recent months, again, come back to what Adam was saying before, which is there is this distinction between the health and social care systems, even though we want them to work together seamlessly for the people who are accessing services across the two in the course of their week or their daily lives. But we also need to think about what does the social care system or provider need from the data for itself, for its ongoing operations, and it's not always what's contained within the health coding. So there's got to be a question mark about how we identify the gaps in the health coding, and then what we need to develop bespoke for social care potentially, it seems to me. And I think the other side is obviously people who are working out there in enterprise and business that want to deliver new data-driven tools and technologies to support people in receipt of social care services or those providing it. They are crying out for standards because obviously it's very difficult to develop a great tool and then find that most of the people out there in the landscape can't use it because they have a different approach to their IT systems.
Thanks, Anne-Marie. I think we take a couple of more questions, and I have first, is anyone looking at common indicators for social care providers to help them better measure and improve performance rather than the outcome of care? Anyone want to jump in on that one?
I'm happy to have a go. I mean, I think the question about what's meant by performance in this context, but yes, I mean, I think the one of the sort of really sort of exciting and difficult things that the community of practice could engage with is about how to foster better collaboration between providers when it comes to issues to do with social care data. It's a difficult environment for providers to operate in, and there's real, you've got to be realistic about the the realities and the business realities that providers are operating in. But there are shared problems here, and if we could find problems where providers are willing to come together and share ideas and collaborate more, share data, and I think that would be quite an exciting prospect. And I would love if the community of practice could explore that in a bit more detail.
Thanks, Adam. So one other question here is, one of the areas I'm most interested in is how to support information sharing between social care and key partners to give a broader view of individual people and the population health. Colleagues do not understand the range of wealth of data that is held by social care partners. One problem we have is the lack of common scales and lack of coding of data in social care, which makes it hard to understand trends over time and compare information with health colleagues. And I think this is something that we have also highlighted in previous work, is exactly this, the difficulty with comparing different data sets from different places. And I see Sophie, you nodding there, so I was going to hand that one to you anyway.
Yeah, no, I would agree with that. It is really difficult, and I suppose this is part of the work that we're doing with the 4 nations in terms of not just looking at how we can compare data across the 4 nations, but also different data sets that we have within each of the nations. So we're trying to put together a matrix outlining, you know, what data can and cannot be compared. And you also have some data sets where certain aspects can be compared because they're the same definitions used, but then maybe timelines don't join up and things like that. So this is what we're trying to explore with the piece of work that we're doing with the 4 nations, and that, like I've mentioned, that will sit on our landscape page. But it is really difficult because of all of the, you know, kind of piecemeal data sets that seem to be out there, and it's trying to bring them together in a way that, you know, is understandable for users of the data. And what we're trying to do as well is pinpoint to those data sets that we think would be most useful for users to go to for certain things. So, you know, if a user wants to understand something like the number of care home residents, for instance, what data set we would recommend to use, what others are available, and how they're comparable or not comparable. So this is something we're trying to explore through that piece of work that we're doing, but it is quite a big task, but it's something that, you know, we should do over the coming months.
Thanks, Sophie. Anne-Marie, do you have anything to add on that, considering the work that you have been involved with over the last 6 to 12 months?
Oh, this is such a rich subject, and I know that Sophie and Adam and I, we feel a bit battle-worn by trying to sort of get our heads around all the different gaps and opportunities and ways to link all this different information out there. I think it's absolutely vital that the community grows and is as diverse as possible and brings together all of these sorts of key questions, because I think they're too big for any one organisation to wrap their head around and really address in isolation. I think in particular, I think Josephine and I have in battle together really for the last 2 years, finding more gaps than answers and insights. And I think now working with the ONS and certainly earlier in the year with Health Foundation to talk to other stakeholders, that's a common occurrence. And so too often you ask questions that you can't answer because there's simply just not enough information, or there's not enough that links together, or people that generate information data don't actually think about the questions people might want answered. I think particularly in the context of pandemic, that's been hugely apparent when we've been contacted for what seem like really simple answers. How many people are currently in receipt of domiciliary care? Not easy questions. And right across the system, we need to kind of get better at saying what are the key questions we need to address and answer. And then where do we make a start together and collaboratively? I don't think that helps answer the question per se, Josephine, but I think that's the spirit in which this event today in the community practice is intended, really, just to say that I think joining forces across a range of organisations, which is quite remarkable in terms of this launch event, just to ensure that people come together and start to think about how we can collaborate and speed up improvements is right at its very heart.
Thanks. Yeah, I completely agree with the frustration over the gaps, because every time we do some research, it seems like we're finding more gaps than answers, which I guess is the nature of research. But hopefully what we'll be doing with this can help at least bridge some of those, and to have more complete data sets in place. I have another question for Sophie, which is about the landscape tool, which is asking, the landscape tool and other data publications look great. Is it in plan to expose any of these via IPA so that analytics teams in the care sector can use it to overlay with their own reporting applications?
That's a really good question, and would probably be one for our technical team who understand a little bit more about how this data is kind of uploaded and things like that. But I would agree that it's really important that the data is shared publicly and in a way that makes it easier for people to pick up and use themselves. And if there's a way that we can support that, through things like an API, I can certainly look into whether that would be available. We have a team here who produce and work on the landscape with us, and the landscape's actually done by an external party, but we have a team that liaise with them, so I can explore that with them, certainly.
Thank you, Sophie. So we have another one here which is a very broad and wide question, which is, would love to know of any plans to create combined health and social care data sets. And this is something that we have talked about before in relation to this community of practice, because there has been some questions raised about why having a separate community for social care practice, for example, rather than linking the two. The idea with doing this is not that we want to single out social care and keep it completely separate from health, because of course it is not. The issue though is that social care, as we have heard through a lot of what has been said today, has tended to be the poor cousin, if you like, in relation to health, and where there's a lot less data available. So therefore the reason for focusing just on social care is to try and elevate the status of social care and social care data, so that we have a rich and usable resources in this area that can be brought together, and then obviously with the ultimate aim of being able to link it into healthcare. But just as a kind of finishing overarching question, I wonder if you would like to take it, maybe for Adam actually, in terms of the work that you're doing in the Health Foundation in linking health and social care. How do you see the sort of relationship between the two, and how we best look at them together without losing social care in there?
I think there's some really exciting things going on with health and social care data. A lot of different areas of the UK have already brought together some fantastic data sets. We're working actually with some of those areas. The Health Foundation, we've got an initiative called the Network Data Lab, which is partnering with five parts of the country: Grampian, Liverpool, Leeds, London, and Wales, using those linked data sets to understand how people move across the health and care system. There's tremendous amount of work underway on shared records for direct care as well, which has wonderful opportunities to integrate care around the needs of the individual, provide more seamless care, which is badly needed. That is all within the scope, I think, for the discussion of the community of practice, and I hope we get into the opportunities and challenges posed by that kind of agenda. I wouldn't say that's the totality of what we need to tackle, because there are other issues to do with how data can be used to support social care users, for example, individuals able to make good decisions about where to go for care, the families of social care workers able to get good information about the care that's received, about data for improving social care services, data for managing social care, data for innovation. So there's a wide range of issues here to tackle. And it just strikes me that there are some specific sort of specifics to do with social care that really warrant the right degree of time and attention. And some brilliant practice going on in social care, really great innovation happening. And actually, I think there's in some ways a lot more potential in social care for digital provision than in healthcare in some ways. So I think it's all in scope, and just really looking forward to engaging and learning from you and some of the excellent practice already out there through the forum.
Thank you, and I think we'll round up by asking the same question also of Sophie. How is the linking between health and social care within the ONS?
Yeah, so this is something that we're trying to do more of. So as I mentioned, we have the unpaid care question on our census, and we have Census Day next year, so we'll have more up-to-date information available, but we'll also have update information on communal establishments as well. We have a number of different health data sets now available in the office. So obviously I've mentioned the death registrations data, but through the work that we're doing with the Circle group, we hope to maybe link unpaid care to some information that we have. We've got the hospital episode statistics data set. We also have the improving access to psychological therapies data set, and at the moment we have the general practice extraction service, but it's for COVID purposes only at the moment. So we're trying to do more to link our census data and any information we have on care to these health data sets. We've also got the longitudinal study as well, which takes from the census and tracks people from census, so unpaid carers and things like that, over a period of time. And that data is linked to data from PHE and other data sets as well. So for that reason, you can't do patient level linkage to that data set, but looking at linking health data to social care data is something that we are trying to do more of, and is in our analysis plans that I referred to within the publication, within the presentation when I mentioned the census work that we're doing. It's part of our census analysis plans going forward. So definitely something that we're trying to do more of and tease more health and social care related data out.
Thank you, Sophie. I am going to round up this event now. We're coming up to 12 o'clock, so we are at the end of our hour. So we are going to be writing up this launch event, so it's going to be published as a blog on the Future Care Capital website. So keep an eye out for that. We will link that through social media and other events, and we might link that back through the Eventbrite contact as well, so you can get it through there. Some people have asked about the link for signing up for the discussion forum, and I will make sure to resend that to everyone as well. We've already had quite a few people signing up to that, so that's really great. We got a lot of conversation, a lot of questions and answers and comments coming through the Q&A, so we will make sure to round up all of that as well and make it available through our website and through the Community of Practice forum, so that people can access that after. And I think that is all I would like to say for now. I would want to thank everyone, thank all of our panels, all of our speakers, and all of you in the audience for coming along and listening today. And we hope to see you soon in the community. Thank you.
Everything.